Have you ever gone to the doctor's office and gotten your blood work, gotten the results, and they send you the results and you have no idea what you're looking at? Well, if you're curious as to what all of these different measurements mean, well, this is the right video for you. Hey guys, my name is Philip with MD Fit. I'm a fourth year medical student interested in longevity, health optimization, and performance medicine. And today we're talking about the complete blood count. We're going to be breaking down all of the different blood work parameters that you can get and what they mean. Today we're focusing on one measurement, the CBC. So let's get into it. Starting with red blood cells. Your red blood cell count is given to you, and it's essentially just a measure or a reading of how many red blood cells there are per volume or unit of measurement within your system, within your body. And it's the main oxygen carrying cell in your body. Your hemoglobin is a concentration of this iron containing protein that binds oxygen via what's known as heme. And heme is a protein with a lot of iron in it within your red blood cells. So your red blood cells carry around hemoglobin. Your hematocrit is a fraction of blood, or the fraction of blood volume made up of red blood cells. So it indicates how packed the blood is within your cells. When looking at red blood cells, they also look at the morphology or the shape of the red blood cell that could potentially indicate certain issues. First is the MCV, or mean corpuscular volume, which is essentially just a measurement of the average red blood cell size. MCH and MCHC as well are also measured. MCH is mean corpuscular hemoglobin, and MCHC is mean corpuscular hemoglobin concentration, which is essentially just a measurement of how much hemoglobin per cell there is and how concentrated the hemoglobin is. Finally, they also look at RDW, which stands for red cell distribution width, which is a measure of the variation in red blood cell size. So are they very uniform, or is there a large mix of different sizes between large and small cells? So you don't necessarily just want the average, right? Because if you have a ton of really small and a ton of really big, that would be indicative of some kind of issue, probably within the bone marrow. And so by looking at RDW, you also look at the variation within the size. So you're not necessarily going to get this average that could look normal on your MCV. So if your average looks normal on your MCV, but your RDW is off, that could be a sign that something is off. So now we're going to talk a little bit about what they're looking for and what they're looking at when they're looking at your hemoglobin, your red blood cells, and your hematocrit. So low hemoglobin, hematocrit, or red blood cell count can be due to a variety of conditions. There are three main buckets that we look at as to why somebody's red blood cell count, hemoglobin, or hematocrit may be down. First, decreased production. Second is loss of blood. And third is destruction of blood. So in decreased production, you would see things like a nutrient deficiency. Something like iron deficiency, which is very common, can typically cause reduced production of hemoglobin. In addition, vitamin B12 as well as folate are really important for red blood cell production, and thus decreased intake or deficiencies can lead to lower hemoglobin, hematocrit, and red blood cell readings. Additionally, chronic kidney disease. EPO, or erythropoietin, is a hormone that is released or secreted by the kidneys, and it tells the bone marrow to produce more red blood cells. If you have diseased kidneys, they're not functioning properly, and thus they're not going to signal your bone marrow to produce as much blood. And so thus, when you have kidney failure patients, oftentimes you see that they're pretty anemic. In addition, chronic infections, autoimmune diseases, and cancers can also be a result or a cause of anemia. Bone marrow failure, in addition, due to things like chemotherapy, radiation, leukemias, myelodysplastic syndrome, or aplastic anemia, can also cause anemia. Now moving on to loss. So blood loss can be a very common cause of anemia. Heavy menstrual bleeding, GI ulcers, surgery, or trauma are all very common causes of blood loss. And some of these things, obviously, if you get into an accident and you lose a lot of blood, you can see that. But if you have an ulcer, maybe these things can go undetected for a while, so it's just a small amount of blood over a long period of time. Finally, increased destruction of red blood cells can come as a result of autoimmune hemolytic anemias, hereditary anemias like sickle cell anemia or spherocytosis, hereditary spherocytosis, mechanical destruction through prosthetic valves or microangiopathic hemolytic anemia, MAHA, it's not really that important that you understand exactly what the processes are that underlie these anemias, but that is what is essentially being looked at, right? If you have an anemia, they're going to go down the pathway and examine exactly what's causing this, right? They'll look for signs of iron deficiency through bleeding and blood loss, right? They'll look at your iron levels. They'll look at ferritin and transferrin. They'll look at your certain autoimmune markers to necessarily see if you have some kind of autoimmune condition. They'll look at your kidney function, and all of these things can be a cause of anemia. Now, moving on to erythrocytosis, which is essentially the opposite of anemia, high red blood cell count, high hematocrit, and high hemoglobin concentration. What are the different causes of elevations? Dehydration from things like vomiting, diarrhea, diuretics, or heavy alcohol use can all cause a relative increase or erythrocytosis seen on your blood work. Additionally, there is also what's known as a true increase in red cell mass. So there's this relative increase that can be just due to a lack of volume in the blood, and thus it seems like your blood is far more concentrated and there's more cells per unit of volume. But there can also be what's known as a true increase, right? If you're not dehydrated, you can also have more cells, and this can be due to hypoxia, right? If you have COPD or a lung condition that causes you to not get as much oxygen, your body will start to release EPO and create more blood cells to oxygenate your body. Also, sleep apnea, high altitude, heavy smoking, and certain heart conditions can all cause a true increase in red cell mass. Additionally, certain primary marrow diseases like polycythemia vera and other myeloproliferative neoplasms can cause an increase in red blood cell production that are essentially aberrant and unregulated. Additionally, EPO secreting tumors on the kidney like clear cell carcinoma can be a cause for aberrant EPO production and then thus signaling too much red blood cell production from the bone marrow, thus triggering erythrocytosis. So your kidneys act like oxygen sensors, and when your tissues feel hypoxic, they release more EPO, telling the marrow to turn up red blood cell production. That's essentially the mechanism that erythrocytosis can be triggered through. And anywhere along that pathway that can be disrupted can potentially cause either erythrocytosis or anemia. So now let's get into MCV. So MCV has three different patterns. You have a low, high, or normal MCV essentially. So mean corpuscular volume, which is a measure of your hemoglobin size, right, can be due to a variety of conditions. If it's too small, you have what's known as a microcytic anemia. Most often this is due to iron deficiency, but also there can also be genetic conditions like thalassemias, or even if you have a illness or some kind of like cancer, for example, you can see a microcytic anemia due to what's known as anemia of chronic disease. If you have high MCV, your red blood cells are too big. This can be due to vitamin B12 or folate deficiency typically. This is also a result of heavy alcohol use, liver disease, hypothyroidism, or potentially some medications. A normal MCV can also be still present in an anemia case, right? You can have anemia in a normal MCV, and this can be seen in anemia of chronic disease, kidney disease, or acute blood loss. There might not be an issue with the body's ability to form a red blood cell. There just could be an issue with the signaling that's involved. So we talked about the red blood cells. Now let's talk about the white blood cells. The total white blood cell count is a concentration of all of the immune cells in your blood in that moment. The differential, you have what's known as a CBC with diff. And the differential essentially is the proportion of different types of immune cells, whether it be neutrophils, lymphocytes, monocytes, eosinophils, or basophils. So you have total white blood cells, and then you have the breakdown of all of the different types of white blood cells that are present within your body. This is known as the differential. So what can be some causes of high white blood cell count, also known as a leukocytosis? This can be due to infection, right? When white blood cells are there to fight infections. Inflammation or tissue injury due to like autoimmune diseases, trauma, surgery, heart attack, gout even can be a large trigger for inflammation. Physiologic stress due to intense exercise, smoking, pregnancy. Also, medications like corticosteroids or growth factors can stimulate the release and proliferation of white blood cells. Finally, similarly to red blood cells, you can also have a bone marrow issue or overproduction within the bone marrow that due to things like leukemias or a myeloproliferative disorder. Now, what could be a cause of low white blood cell count or leukopenia? Things like severe viral infections or severe sepsis that can consume, that can be the result of a lot of consumption of the white blood cells, as well as marrow suppression. They can actually suppress the bone marrow if the infection gets bad enough. You can also have bone marrow suppression through things like chemotherapy, radiation, cancers, myelodysplastic syndrome, aplastic anemia. These are all conditions that can cause a leukopenia. Autoimmune destruction or sequestration in an enlarged spleen. Splenic sequestration can often be a cause of leukopenia, as well as certain drug effects and some chronic illnesses. So overall, a high white blood cell count usually means that your immune system is mobilizing to fight some kind of infection or inflammation, or the marrow is just overproducing because of a aberrant signaling like a cancer, right? Like a myelodysplastic syndrome. Low counts usually mean that the body and the immune system is suppressed, or the cells are being destroyed faster than they're made. So now we're going to talk about the differential. So there are 5 different types of, or 5 characters of white blood cells. You have neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So neutrophils are very fast responding, and they comprise most of the white blood cells within your body. That they're the highest percentage of all white blood cells. They respond to bacteria and pus forming infections. Lymphocytes are involved in adaptive immunity. They are composed of B and T cells, as well as natural killer cells. Monocytes are kind of a cleanup crew in the sense they're immature cells, and they are immature in the blood, but then they differentiate at the tissue, typically into a macrophage, but also maybe a dendritic cell. Macrophages are, they consume and they phagocytose or eat pathogens, and dendritic cells are more signaling immune cells. Eosinophils will be high if you have a parasitic infection or an allergy, and as well as basophils are loaded with histamine for allergies and inflammation. And so when you take a allergy medication for seasonal allergies, an antihistamine, you are acting at the level of the basophils to prevent them from acting, degranulating, and giving you all of these kind of nasty symptoms that don't necessarily need to be there. Your body is overreacting. So for neutrophils, what can cause high neutrophil count? Well, infection, bacterial infection, acute inflammation, tissue necrosis like a heart attack or trauma, stress, steroids, corticosteroids, not anabolics, or some myeloproliferative diseases or diseases at the bone marrow. A cause of low or suppressed neutrophil count can be due to chemotherapy, radiation, marrow failure, drugs, viral infections, severe sepsis, as well as autoimmune neutropenia. So moving on to platelets. Platelets are an anucleate cell, meaning they don't have a nucleus, and they're fragments actually of a cell called a megakaryocyte, and they're essentially just used to keep you from bleeding out. They adhere to damaged vessel walls and recruit clotting factors to stop bleeding. Low platelets, also known as thrombocytopenia, can be due to a variety of conditions due to decreased production, whether it be radiation or chemo or leukemias or myelodysplastic syndrome, to an increased destruction or consumption through autoimmune mediated mechanisms like ITP or drug-induced immune destruction, as well as infections, sepsis, or a variety of other kind of conditions. It can also be caused by a sequestration. In an enlarged spleen, the spleen will trap too many platelets and cause you to have a low platelet count in your blood. High platelets or thrombocytosis can be caused due to a variety of factors, from a reactive thrombocytosis, your body is trying to react to something. This can be due to an infection or inflammation, recent surgery, right, where there's a lot of damage to tissues, trauma, iron deficiency anemia, or like even if you get your spleen removed, your platelets will oftentimes be elevated. Or in a primary overproduction where the bone marrow just starts going haywire and producing too many platelets. And this can be seen in a variety of conditions like essential thrombocytopenia or other myeloproliferative neoplasms. So that's going to be it for the CBC, or the complete blood count. That is essentially everything that you're going to be looking at and everything that the doctor is looking for. So if you have something that is off, right, if you see an abnormality, your doctor is going to be following up on those readings and investigating and going down each of these buckets, whether it be looking at the bone marrow or looking at whether they're looking for a primary cause like bone marrow production, or a secondary cause, whether it be destruction after production or overconsumption through some other means within the body. So I hope that was interesting and informative for you guys. If you found it interesting, please remember to like, comment, and subscribe. It really helps with the algorithm. And with that, we'll see you in part 2 where we talk about the CMP, the Comprehensive Metabolic Panel.